In my podcast, I discuss IV nutrient therapy, and some of the listeners want to know, what is IV nutrient therapy? So today we'll discuss the pros and cons of IV nutrient therapy. If you enjoyed this video, please be sure to like and subscribe to our channel for more videos like this, and be sure to hit the alert button to be notified of new videos each week. Now, recently, I've been dealing with symptoms of chronic fatigue syndrome and post-viral syndrome. I believe that I got viral meningitis back in February because I had a really depleted immune system. So, rather recently, I've been going for a series of IV nutrients, and I do believe it's helping. And the number one thing that's helping is glutathione. So, glutathione is a antioxidant, and you can take it orally. I believe you can also take it dermally through the skin. But people are getting great results using glutathione by IV, and I haven't used this myself, but one of my friends actually gets IM, or intramuscular injection, so injection in an arm or injection in the buttocks of glutathione. Now, when I get glutathione IV, I get it with other nutrients, vitamin C and vitamin B. And I noticed when I after the vitamin C and the vitamin B, the vitamin C and B are mixed together, and that takes about an hour, maybe longer, to infuse in my body. And you sit back in a easy boy chair and you can read or do some work if you on a computer if you'd like. So they try to create a comfortable, relaxing environment where you're hooked up to an IV machine. There's other people also getting the IVs at the same time. This is very common in these facilities. They have multiple people in easy chairs getting IVs. And so the glutathione is done later after they've pushed the vitamin C and the B vitamins in my system. So they administer it separately. And so I feel good uh, after the C and the B. But after they put in the glutathione, I feel great sometimes. And it's really helped my energy level. It's helped my brain fog along with other uh, supplements and herbs. And the most remarkable thing is I've had knee problems and inflammation in my knee. And that's probably due to playing too much basketball in my youth on concrete. And also, I had an injury a couple years ago. So after the glutathione injection, IV, my knee feels a lot better. Not 100%, but maybe 50% better. That's pretty good. I do find after my first IV that I got an IV on the Thursday, and then it had worn off over the weekend. And so on a Tuesday, when I got my next IV, I really, really noticed the results, and I noticed when it started fading from my body. So who should consider nutrient IVs? I think it's really essential to consider it, at least for people that have chronic fatigue syndrome, fibromyalgia, long COVID, or other what they call long haul diseases. These are diseases where there's a typically recovery may last many months, and in some cases a year. Another example of a long haul disease is chronic Lyme disease. So IVs can definitely help these conditions. In terms of my own finding, my own experience, I definitely can say glutathione for me works great for my friend who gets it IV or IM. But the jury's still out on vitamin C and the B vitamins. And that's partly because IV therapy is not cheap. So let's look at some of the pros and cons of getting IV nutrients. The first pro is that it's effective, and at least in my case, if you take glutathione, the results are immediate. So that's one reason of taking it. Another reason of taking IV nutrients is that IV vitamin C is shown to be useful against pneumonia, influenza, and may have a role against COVID virus. So, for an antiviral approach, you do want vitamin C, My research is that you want to take at least 25 grams of vitamin C in an IV if you're specifically using it for its anti-infective effects. But my approach is if you're not using it as an anti-infective, you might not need vitamin C and maybe just B vitamins or just glutathione or maybe a combination of glutathione and B vitamins. So the bottom line is that the positives are IV therapy can be immediate, can be effective, especially if you're using the correct dosage. And let's look at some of the negatives. Well, one of the negatives is you have to get an IV line inserted in your body, and sometimes it can be painful. And the nurse that inserts my IV does a lot better job than the nurses at the hospital or the phlebotomist at the hospital. But but if you get a wrong stick, it can be very painful. So that's one reason to not get an IV nutrient. Another reason to not get an IV nutrient is that it's expensive. And so people are looking at spending anywhere from $100 to $500 per infusion. That means per each time that you go to the doctor's office where they do the infusion. And so, and then if you need to take many infusions, I'm going to be taking a total of 8 for my chronic fatigue syndrome symptoms. That can get into many thousands of dollars. And then the final negative is that insurance companies do not cover this. So I asked one of my colleagues who practices in Florida and administers IV nutrients, and I said, "Do they let you do?" He's a physician. I said, "Do they let you do IV nutrients?" They said, "As long as I, number one, don't bill insurance, and number two, don't advertise." So it can actually be hard to find somebody that does IV nutrition. Your best bet, in my view, is to see either an integrative physician, sometimes this is known as a holistic physician, or seeing a naturopath. So MDs are physicians. That's M as in Michael, D as in doctor. NDs are naturopaths. That's naturopathic doctor. And NDs in some states, particularly California, can also administer IV nutrients. But again, this is not something that's going to be widely advertised. So, how can you find a naturopath or integrative physician that does IV therapy? The best way is word of mouth. And I would say the second best is to go online and try to find an integrative physician in your area or a naturopath and ask them if they do IV nutrient therapy. Whether or not you decide to get IV treatment or not, I hope you found that this useful. Be sure to subscribe, that really helps us, and let us know what you think. For more information, visit our website, getwellfoundation.org. Thanks for joining us, and we'll see you next time.